Welcome to the Prostate Health channel. If you're new here, we're really glad you're joining us today. On this channel, we dive deep into men's health, especially issues related to the prostate and sexual wellness that are often misunderstood or overlooked. In today's video, we're going to unpack something that affects millions of people, often in silence: the link between blood pressure medications and erectile dysfunction. If you've been wondering why your erections aren't what they used to be, and you're taking meds for high blood pressure, this video is for you. Let's start with the basics. High blood pressure, or hypertension, is a major health issue worldwide, and unfortunately, it's also one of the biggest contributors to sexual dysfunction in both men and women. You might be surprised to learn that up to 70% of men with high blood pressure also experience problems with erections. That's no coincidence. Here's why. When blood pressure is too high, it slowly damages the inner lining of blood vessels, called the endothelium. This damage makes the vessels less flexible and less efficient at delivering blood. Poor blood circulation affects many parts of the body, but it's especially critical for sexual function. After all, an erection depends on one thing more than anything else: healthy blood flow to the penis. When that's compromised, so is your ability to perform sexually. But here's where things get even more complicated. While high blood pressure itself can cause erectile dysfunction, the very medications we use to treat it can also lead to sexual side effects. It's a double-edged sword. You treat one problem, but you might create another. That said, not all blood pressure medications are the same. Some are more likely to cause sexual issues, while others may be safer, or even helpful. Let's break it down. There are three main categories of blood pressure meds that have been linked to sexual dysfunction. 1. Centrally acting agents like clonidine and methyldopa. 2. Diuretics, also known as water pills. 3. Non-selective beta blockers such as propranolol and metoprolol. Let's start with the centrally acting agents. These work by affecting your brain's ability to send certain nerve signals that control blood pressure, but they also suppress your sympathetic nervous system, which is a key player in arousal. When your heart rate doesn't increase properly, and your brain doesn't register arousal, it's much harder to achieve an erection, even if you're mentally in the mood. Next up are diuretics. These medications lower your blood pressure by helping your body get rid of excess fluid and salt. That sounds good, right? But the downside is that they also reduce overall blood volume and change the way blood vessels behave, sometimes making them more narrow. Less blood volume and tighter vessels mean less circulation to the genitals, and that means weaker erections or none at all. Then we have the non-selective beta blockers. These medications are often prescribed after heart attacks or for irregular heart rhythms. They reduce your heart rate and the force of your heartbeat, which lowers your blood pressure. But this can also reduce blood flow to the penis and lower libido. Studies have shown that men on certain beta blockers report higher rates of erectile problems than those not on blood pressure meds. But here's the hopeful part. Not all blood pressure medications are harmful to your sex life. In fact, some may even help. One group that stands out is angiotensin receptor blockers, ARBs. These include drugs like valsartan and losartan. They work by relaxing the blood vessels, improving circulation, and reducing the damage caused by high blood pressure. Research has shown that men taking ARBs often report improvements in sexual function, more frequent erections, better orgasms, and higher overall satisfaction. Another group to watch is the ACE inhibitors. These work in a similar way to ARBs by blocking the production of a chemical that narrows blood vessels. By keeping your vessels relaxed and open, they support better blood flow, which is essential for sexual health. Calcium channel blockers, like amlodipine, are also considered to have a neutral, or even slightly positive, effect on sexual function. They help relax the blood vessels without messing with your central nervous system, which means your arousal response stays intact. Interestingly, even among beta blockers, there are differences. Selective beta blockers, such as nebivolol, are designed to be more targeted in their action. Some studies show they may actually improve erectile function, possibly because they increase the body's natural production of nitric oxide, a critical chemical that relaxes blood vessels and helps generate strong erections. So let's recap. The worst offenders when it comes to sexual side effects are centrally acting agents like clonidine and methyldopa, diuretics, thiazides and others, non-selective beta blockers like propranolol and metoprolol. On the other hand, the more sexual health-friendly medications are angiotensin receptor blockers, ARBs, ACE inhibitors, calcium channel blockers, selective beta blockers like nebivolol. But remember, medication is only one part of the picture. Your lifestyle plays a massive role in your blood pressure and your sexual function. Here are some things you can do right now to take control of both. Maintain a healthy weight, exercise regularly. Just 30 minutes a day can make a big difference. Eat a heart-healthy diet, like the DASH or Mediterranean diet. Limit alcohol and avoid recreational drugs. Quit smoking. Seriously, smoking destroys blood vessels and ruins erections. And most importantly, don't ever stop your blood pressure medication without talking to your doctor first. If you're experiencing side effects, ask your doctor about switching to one of the more favorable options we've discussed. The goal is to find a balance, protecting your heart while preserving your sexual health. So if you've been noticing changes in your erections and you're on medication for high blood pressure, this could be the missing piece of the puzzle. Knowledge is power, and taking the right steps, medically and lifestyle-wise, can restore your confidence and quality of life. Thank you for watching this video on the Prostate Health channel. If you learned something new today, please give this video a thumbs up, share it with someone who might benefit, and subscribe to the channel so you never miss out on important health information. We post weekly videos to help you take charge of your health because you're worth it. Stay healthy, stay informed, and see you in the next video.